This segment is sponsored by Holy Cross Health. If you have uterine fibroids, you may want to know about a minimally invasive procedure that is a viable alternative to traditional surgical treatments. It is called uterine fibroid embolization. And here to tell us about how it works and a little bit more about it, we have Dr. Asante Dixon, who is the Chief of Radiology at Holy Cross Health. Welcome into Great Day, Washington.
Thank you. Good morning. Thank you for having me.
For sure. This seems like a good time to be having this discussion as it is Cervical Health Awareness Month.
Yes. So we are in Cervical Health Awareness Month, and so this topic of fibroids and fibroid treatment fits right in. So we will be discussing today exactly what are fibroids, how they present, and how we can potentially treat them.
Okay, I mentioned it's UFE, but uterine fibroid embolization. Is that a viable alternative to the traditional surgical treatments that you would think that are out there for a fibroid?
Yes, so classically, fibroids, which are small growths, well, they can be small, they can be large, growths in the uterus, they were treated by surgery. So you would make an incision or through ports where now we can actually look through the abdomen without making large incisions, and the fibroids are actually resected by the surgeon.
Okay.
In fibroid embolization, which is predominantly performed by interventional radiologists, what we do is we enter the body not through incisions or portholes, but we actually enter your body through small, tiny holes, either in your groin or in your wrist. So your recovery time is significantly lessened compared to surgery.
Wow, this is amazing. That's most of the procedure and how it works, right? Is that you're going in with the minimally invasive techniques?
Yes. Okay. So your recovery time with surgery could be days, could be weeks, depending on depending on what the extent of the surgery was or is. In our case, using technology, we are laying you on a table. It's like we're playing PlayStation. So we've got large screens that are hanging from the ceiling, and we place catheters either in your groin or in your wrist, and we manipulate the catheters. Let's say we're in your wrist, so we would manipulate the catheter from your wrist, up your arm, shoulder, down past your heart, down through your chest and abdomen, and then we go into the arteries that feed your uterus. And while we're watching the screen, we are manipulating the end of the catheter that's outside of your body, and we're injecting material. I'll just say it's like these little tiny microscopic balls.
Okay.
And we mix it up in what we call a slurry, and we inject those balls into the vessels that feed the fibroid.
Wow.
And so with the occlusion of that vessel, or the shutting down of that vessel, you've now diminished the blood supply to that fibroid.
Okay.
All tissue needs blood to live. So when you shut down the blood supply, the fibroid will shrink and or die, depending on the size of the fibroid.
If someone's listening to this, they think maybe that's an option for me, but they want to get pregnant, they want to have a normal pregnancy. Is that still an option after you have a surgery like this?
Absolutely. So the big thing is many patients come to us because they want to keep their uterus, and their OBGYN may say, you may need a hysterectomy. Now, obviously, once you've had your uterus removed, there's no more pregnancy for you. Yeah. So we are an alternative for some patients, because if you want to get pregnant, you can still have this procedure. Now, there is a small risk that in lessening the blood supply to your uterus, some patients may have complications with pregnancy in the future, but the vast majority of patients that come to us and have this procedure will still have a uncomplicated route to pregnancy in the future.
Okay, and then real fast, I know this would also impact someone's physical and mental health. Can you say how you kind of just put that all together in your outlook?
So I always say we are physicians first. We've trained a long time to do these procedures. Radiologists, we are highly specialized. We are technical men and women that we do excellent work in the minimally invasive field. However, I remind everybody that when it comes to physical and mental health, you want to look for a team that has people that prioritize people. It doesn't matter where you go. I don't care what hospital you go to. The hospital itself is not what is going to give you your mental support. It is the team that you're working with, the individuals that will prioritize your mental and your physical health during your stay.
That's what you want to look for. Thank you for being here, for walking us through this. I know if you would like to learn more, you're looking for that team, you can schedule an appointment for your procedure by visiting holycrosshealth.org.